name is Christina Miner. Welcome to Our Scars Speak. And before we get into the podcast for today, I want to make for sure that we have the disclaimer, which is that we are not medical professionals. We are just here to give our experience and to give education about things that we do know and to give support for the audience. So today, the guest for today is Dr. Corrine Ellsworth-Beaumont. And I met her by way of Touch. Touch is another organization that's for breast cancer and primarily dealing with the African-American community, as well as truly pushing far as doing trials. And they give a ton of information about that. And now they've even started another organization for young women. Do you remember the name of that one, Corrine, by any chance?
Love Your Girls.
Love Your Girls, that's it. So with Love Your Girls is for young women and just for them to learn more about their breast and their body and the signs and the symptoms of potential breast cancer or just being aware. And so I love Touch. I love everything that they're doing over there. But I met Dr. Corrine Ellsworth-Beaumont through them, and it was through Know Your Lemons. So Know Your Lemons is a fascinating organization, which she would tell us all about. And I love it because it's so creative. It's something different. It's something new. It's not just, when you look at the lemons, you don't just think of a woman, you think of men, you think of whatever gender a person is, not just categorized as women, because as we know, breast cancer can affect men and women. So with that being said, after that, I did a ton of research on Know Your Lemons, read Dr. Corrine's information, and I was just fascinated and floored by her story and what led her into creating Know Your Lemons. Looked over all their work, and I was like, I want to be a part of this. I got to be a part of this because I love the way that you can use this material to just teach people and teach multiple people. And I went and researched to see how I could be a part or what they needed help with as far as volunteering. And I found out about becoming a lemonista. So I took the course, which is very, very detailed, and it is lengthy, but it's good information. It's such good information. And it teaches you everything that you need to know about breast health and to be able to educate yourself to give everyone, for people to understand what the signs and symptoms are so that you can teach whomever you come in contact with. So I'm official lemonista. I'm certified and I'm so excited about it. But from there, I just wanted her to come on and just share with everyone out of her mouth what got her here. But before we get to Know Your Lemons, there was Corrine before Dr. Corrine. So if you don't mind, just share a little bit about who you are.
Yeah. Well, first of all, thank you, Christina, for inviting me to be on. We absolutely love Touch. Touch is one of our partners, and our goal as a charity is that the enemy is cancer. It's not each other, right? And if we coordinate and partner with each other, we can do amazing things. And Touch is one of those incredible organizations that we get to magnify each other's work, which is awesome. So a little bit about me. I was born and raised in Idaho. I grew up on a potato farm. My dad is a farmer and an inventor. My mom is a pianist. She taught piano. So I grew up in a really creative, entrepreneurial household, and just had a lot of space and freedom to kind of dream up things and come up with stuff. So that, one of the things I really loved was, and I didn't know the word for it then, but it was design. I loved to make things. I loved to communicate things. And when I went into college, my goal was that I was going to go into advertising. But as I learned more about it, I thought, oh, actually, the thing I really love is the design aspect of communicating. And so that's a little bit about my background, where I grew up. I'm a single mom. I have a 10-year-old daughter. We love to travel. She was born in England. I lived there for 12 years. Her and I are both dual citizens. So we travel back every summer to England to visit family and friends. We try to put little trips in when we go back and forth. And So far, she's been on 105 flights since she was born.
Wow.
So
Wow.
we love to go places. We love to explore new things, and we love to sketch when we travel. So
Oh,
there's a lot of art in our household, which just makes life beautiful. I think you have to surround yourself with great things and make great things and share the things that you
yes.
make to make other people's lives beautiful. So that's the joy that I get to do every day, is I get to make things that help someone else in their life.
That's beautiful. So, and yeah, I love that. 100 and some trips. Wow. That is impressive. That is really impressive. Show and tell, I'm sure, was very amazing. Goes to school. So what exactly could you tell us about your education? You did say a little bit about it, but you are a doctor. So can you elaborate on exactly what your educational background is?
Yeah. So, when you hear about a doctor working in cancer, you automatically think that they're an oncologist or
Mhm.
a radiologist or a researcher. I'm actually a doctor of design. I got my PhD in global communication for breast cancer,
Oh,
in London. That's what brought me to London was that pursuit. And then I also got my master's degree in graphic design, and my bachelor's degree in graphic design, and my associates in graphic design. Like
wow.
everything's graphic design. And then with the PhD, I wanted to take it a step further. But where this project kind of originated was closely tied in with my education.
Mhm.
So I was starting my master's degree in graphic design when I lost my grandmother to breast cancer.
Right.
And she was actually my second grandmother that I lost to breast cancer. So my first grandmother died when my dad was 12. He was the middle child of 5 kids. And that really, of course, impacted his life.
Right.
And that ripple has impacted my life as well. And my second grandmother, died when she was in her early 60s, which is still
Mhm.
very young. And so at the time, I thought, I think this is a problem in my family. We
Mhm.
weren't really talking about it. I don't think we were like intentionally avoiding the topic. I just think we didn't know how to raise the topic.
Right.
We knew what to discuss. And when we're mourning someone that we've lost, we don't start thinking about like, all right, so here's this problem, and now we need to address it,
Right.
right? We're dealing with our grief. And so I ended up going to a cancer library. And I just walked in as, a young 20-year-old, and I said, I think I might have a increased risk for breast cancer. What should I be doing? And they said, well, we don't have anyone your age that comes in here to ask these questions. So, here's some websites, here are some pamphlets, here's a couple books. And I was there for a few hours looking up all kinds of things, and I left with more questions than I had going in. And my main questions were this: I wanted to know, did I have an increased risk for breast cancer?
Mhm.
When should I start getting mammograms? And what does a cancerous lump feel like, right? Because we're told to do self-exams and check
Mhm.
for a lump. But I'm like, my breasts are lumpy. Is that normal? Are these lumps concerning? Are they like, I had no context. I had
Right.
no knowledge or education, because in school, like, we don't talk about breasts. Like,
Mhm.
we pretty much talk about every other body part except
Yeah.
breast, right? And the thinking around this is, oh, well, you don't need to know about breast health now because you're young. So you're going to discover this at some other time in the future
Mhm.
when it is relevant to you. For me, that moment came when I lost 2 grandmothers to
Right.
breast cancer. And I just thought that bar is way too high. It shouldn't require 2 family members dying for me to get educated about my breast health.
Mhm.
So, and as I was looking at all these materials, everything was quite kind of clinical in how it was designed, really text heavy. The images were mostly decoration and like a group of like various women all smiling together in a photo, right?
Yep.
And so I'm like, I think the visuals can be doing a lot more education. So I was looking at this from like a designer's perspective of like, this just really isn't engaging. So that's when I decided to take it on as my master's project to work on over 3 years of I'm going to make learning about breast health more engaging.
Right.
That's where Know Your Lemons kind of began, was I started by I'm like, I need a metaphor because I can't just show breasts. And doing illustrations of breasts have been done
Right.
so much. And so I was looking at watermelons and jugs and cones and like all kinds of things. And after photographing all these different objects, that's when I came across the lemon. And I thought, you know what? A lemon has nipples. A lemon has like skin, right? A lemon is pretty universal around the world. And a cancerous lump often feels hard like a lemon seed and immovable. So it's like the perfect metaphor where you can show a picture and communicate that information without saying a word.
Right.
Like we have a graphic of a lemon sliced in half, see a lemon seed, and you know exactly what it means without having to read anything, which is really important when we're trying to communicate quickly and also help people that have low literacy.
Right. Right.
So.
I thought that was another thing, outside of it just reaches every gender. The other thing was, oh my goodness, if someone cannot read, they can look at that lemon and kind of through the pictures that you have, which are very, very graphic. I mean, as far as like just the illustration of it is absolutely phenomenal. They can look at it and say, oh, okay, oh, drainage or hot to touch, like everything that you gave, even the vein that's on the lemon, because that's what happened to me as well. I've had a very prominent vein. And when I seen all of us, oh my God, it's so relatable for a person who can read and for someone who may not be able to. It just reaches so many areas. Now, I read your bio and you also stated about a friend that had, would you like to share about your?
Yeah. So kind of like the timeline for this was I finished my master's and I had designed the 12 signs of breast cancer image in the egg carton. And so for people who are listening right now, you're probably going, what is this image? So maybe hit pause, go to knowyourlemons.org and look at this picture. It's right on the homepage. And what it is it's 12 lemons inside of an egg carton. And each of those lemons shows a different symptom of breast cancer. And this means we can avoid censorship. It's really colorful and it's super memorable. And so I designed that and then a couple of other graphics. And I realized like, this is great, but no one knows this. Like, this is just my master's project I did in college. It's not really going beyond that border. So I decided to leave my job and get a PhD in global communication in London. And I did that because I wanted to really have it own my time, because I really wanted to do more of this project. I'm like, this needs to get out there. So I spent several years researching everything that I was designing and tweaking it and getting feedback and really kind of making sure these images were communicating really well. And so I finished my PhD. I was teaching entrepreneurship at a business school in London. And then I lost my really close childhood friend to breast cancer. She was in her late 30s, 5 kids, and it was really devastating. And her story was that she had inflammatory breast cancer, didn't know that was a symptom. Her doctor didn't know it was a symptom. It took a lactation nurse at the hospital after she gave birth, like calling her at home saying, I think you need a second opinion. And finally a doctor said, well, why don't we biopsy this? And after the biopsy discovered that it was inflammatory breast cancer, and they did additional imaging and found that it had spread. So she was diagnosed metastatic breast cancer right off the bat in her late 20s. And so, watching her go through that and just thinking of all the other people out there like Suzanne, my friend, that needed to know these symptoms, the doctors that needed to know these symptoms. And, not everyone's breast cancer can be caught early. Some grow very quickly, right? And by the time a symptom shows up, things have already progressed. But for a lot of women, being able to know these symptoms can really make all the difference in getting diagnosed early or not being aware of things. So I remember after her funeral, thinking, that's it. I can't stand this any longer. I just became a single mom and had an 18-month-old daughter, and I quit my job. And I said, I'm going to work on this full time. Like this has to change. So I used my savings to start the charity, and had a little 18-month-old that would crawl under my desk while I worked, and somehow juggled it. And then a year later, this amazing thing happened, which was we went viral. And like not just little bit viral, like global viral. And what happened was a patient in California, there was a game going around Facebook that said, put a heart on someone's wall and don't tell them what it's for. But then when they ask, tell them it's for breast cancer awareness. And so there was a woman that was going through treatment, and lots of her family and friends were like throwing all these hearts onto her Facebook wall. And she wasn't sending hearts back. And so she decided to make a post and switched privacy to public. I don't know why. That's amazing that she did that, because what happened was she wrote this post to her family and friends and said, some of you are probably wondering why I'm not sharing a heart back. And she says, the reason for that is hearts do nothing for awareness. What we need to be doing is sharing images like this, because I had one of these symptoms. And she shared my 12 signs of breast cancer picture. And it ended up getting like 64,000 shares. On this one post. And news media outlets started picking this up. And then before I know it, I'm sitting on the BBC couch talking about why is this campaign making such a big impact. And for about 3 weeks, it was like nonstop inquiries from like Good Housekeeping and Wired, and CNN wanted an interview. And that was amazing. And I would see that like, oh, a lot of inquiries are coming in from Peru right now. It must be hitting in Peru. And it's like Poland's doing this. People are asking for this in Polish. And so that was a really big moment. And it has been spreading ever since. Like it became one of the top 10 tweets in the UK. Just last week, someone tweeted our picture in 2020, and now it's like up to 100,000 shares on that tweet, just randomly, like 3 years later, right? So
is amazing.
It's just this image that goes around. People, when they see it, they want to share it. And right now we've estimated that we've reached 1.85 billion people online with the campaign. A little project that started off with me just living off of my savings, trying to educate people. And now we're in 34 languages. We have about 800 volunteer Lemonistas in over 60 countries. And we've almost taught 100,000 people in person through our volunteer Lemonistas, which is a really exciting milestone we're looking forward to. So, I'm just one person that loves to design, that happened to have family members impacted by breast cancer, that got me curious, that got me thinking I could use my talent for this. I could put my efforts into this. So that started 20 years ago. And now it's an overnight success.
Wow, that is so amazing. So you have, my thing is just so many lives have been saved, I'm sure, through imagery.
Yes.
And that is something, I mean, I'm so thankful that you walked out into what you seen, your vision, and made it come to pass. Now, is this a 501c3 organization as well? Okay.
Yep. Yeah, we are a nonprofit.
Okay. And also, as much as I love, as much as I love Know Your Lemons, you also have another project, I think is done, correct? Dandelions?
Yes. Yeah. Dandelion Health. This is a project I've been working on for 8 years, which is a visual toolkit to help explain a diagnosis.
Yes.
So right now it's for breast cancer, it's for metastatic and early stage breast cancers. And what it is it's a notebook and a piece of paper, and then I'm working on this like digital video component that's going to go with it. But basically how it's used is either you as a patient will bring this piece of paper in, or your healthcare team will have these materials to hand already. And this piece of paper uses the visuals of a dandelion to explain how cancer spreads and what stage the cancer is in. There's a section for imaging that explains like the surgical findings, right? So like if there were lymph nodes that were positive, with the like tumor size, what like all of that stuff. And then you can map things out on the body too, like where the tumor is on the breast. And then on the back is the pathology report. So that tells you the type of breast cancer that it is. So it explains the difference between estrogen positive, progesterone positive, HER2 positive, what's triple negative. All of that is kind of explained, and it asks 4 questions. It says these are like the four things that we use to determine your treatment, the best treatment for you. So first one is subtype, like what type of breast cancer do you have, right? So if it's hormone positive, you're going to need hormone therapy. That's how that works. So it's helping to educate patients so they understand, because the cancer is this kind, I'm going to need these kinds of treatments, because it can be really confusing to like figure out treatments, and well-intentioned family members will send all kinds of suggestions of what's going to help with someone's cancer, right? Which are not that helpful, right? So, but if you're operating in this context of like, I'll just wait for the doctors to hold all the knowledge and they'll always know what everyone on the healthcare team has said to me and all the bases are covered, like that puts patients in a really vulnerable position. So the last part of this is talking about the same approaches you take to removing a dandelion out of the grass in your yard are the same approaches we take to treating cancer. So these are all visuals that are part of this. So for example, chemotherapy is like putting a chemical over the whole lawn, and it's going to impact the things that grow quickly. So it's going to impact the grass and the dandelion, right? Targeted therapy is going to be like putting a chemical over the whole lawn, but it's mostly going to be focused on those dandelions. Is the lawn going to be affected? Yes, but not like it is with chemotherapy. Hormone therapy is going to be mostly targeting those dandelions, but it's going to really be like impacting those seeds. It's trying to keep those seeds from spreading. So it's going to block, so like hormone blockers. And then surgeries like digging it out. Radiation therapy is like taking a magnifying glass and putting over and using rays to wither that specific spot. And then immunotherapy is like strengthening the grass to choke out the weeds, right? Because like when you have a really good lawn, it's hard for those weeds to come in because the grass is taking over. So we're saying here's the 6 ways to approach cancer treatment because of the subtype you have, and you can actually like draw a line because it's this. Then these are the treatment options that we're using, and this is why they're the best. And then we talk about quality of life right alongside those treatment options, because those that kind of get separated for patients, right? It's like treatment. Oh, quality of life. Okay, sure. Like, figure that out, right? So we talk about there's things that you need to do for yourself, like acupuncture or group therapy, like physical fitness, like exercise,
Right.
those types of things. And then we talk about treatment breaks, like how do you make sure that you can understand sometimes you might have to pause treatment because your body needs some time to recover.
Right.
Maybe you've got a major event coming up and you want to kind of, if you can, time how treatments are
Mhm.
working out so you can go to that wedding or, you know, whatever that event is. And then the last one is pain management. How are we making pain management, symptoms management part of this overall treatment plan where
Yeah.
we're seeing as all of these things work together to help
Mm.
patients? So that's the piece of paper that the oncologist member of the healthcare team fills out, and it's mostly checking boxes and a few words here and there. So it's super easy for them to fill out. You take that piece of paper home with this little 4 by 6 inch notebook, and you're going to take the information from that piece of paper and put it into your notebook and fill everything out. And as that happens, as a patient, that will help you learn from
Mhm.
that meeting, because we know during that you have cancer meeting and here's what we're going to do, like in one ear out the other, what is
Yes.
going on, where am I, how did I get here,
Right.
right, is happening. So what the healthcare team does is they just keep repeating themselves until
Mhm.
patients stop asking questions. The healthcare team goes, oh, the patient stopped asking questions, they must know everything they
Right.
need
And
to
they
know.
leave it alone.
Right, but like patients haven't been through this before,
Right.
right? Like they don't know what they don't know. And so having this visually mapped out saying, have you discussed all of these things? Have you talked about
Mhm.
fertility issues? Is that something that you're concerned about?
Right.
Because the healthcare team might not bring it up. And so that's up to you as a patient to be like, hey, can we talk about fertility?
Mhm.
And then the notebook goes into things more in detail, and then blank spots will start to show up. And the patient will go, oh, we haven't talked about genetic testing. This
Right.
is blank, right? Oh, like let's talk more about some physical therapy stuff, because I didn't
Mhm.
realize that this could happen with, you know, getting my lymph nodes removed, that I'm going to
Yeah.
have some lymphedema. So those types of things, it just flags up to the patient. Here's all the basics that should be covered. Then after that, Google to your heart's content, knowing what information applies to
Right.
you, what doesn't apply to you, right? And then you
Yeah.
can go to that next step. But it's all about patients feeling more in control because they
Mhm.
understand what's happening to them and what their choices are, and they have a say in that,
Right.
have a
And
say in their treatment.
I was like, when I seen that one, I guess because I'm what 3 years now out of having breast cancer, I was like, oh my God, this is fascinating. Fascinating because I remember I used to work in the medical field, so I knew a little bit about cancer, but not
Mhm.
a whole lot because I worked in the ICU, CCU, which was cardiac care. So we didn't see a lot of cancer patients, and ER, they're in and out. But when I seen that, because they tell you don't Google, and I'm like, okay, don't Google, but you're spending all of, maybe the first meeting is usually longest, but that's it. I'm
Mhm.
gonna Google. But the beauty about my doctor, she gave me exact sites to go to Google that were
Yes.
legitimate. But if I had that book to actually write down, and it's like a complete guide for
Mhm.
us, because as I was looking at your material for the dandelions, I'm like, oh my goodness, everybody needs this who has cancer. Every breast surgeon, every oncologist, they need this because it gives the pictures, the visuals, of course, and
Mhm.
then it breaks down every little bit. Because even now, when I coach people on the side who are cancer patients, I don't have that material, but I break everything down for them because a lot of them, the doctor didn't go over the grade with them. What type of grade is the cancer? Some of them
Mhm.
don't know their stage. They don't understand the hormones. So
Yep.
having that material can be a visual on top of explanations of what that means. And then to go back and ask your physicians, it gives you, like you said, it gives control, because we lose so much control going through the process of having cancer. And you just feel like you have no control over nothing. And then you start having surgeries and you can't move like you used to, or going through different treatments. So having something to help us, guide us through this, to know that, okay, these things I need to make for sure of, for
Mhm.
my benefit and for
Yeah.
my children's benefit as well, potentially, if there's a gene.
Yeah. Yeah. Exactly.
So that is beautiful. I love it. Well, I know you have an app. Did you want to discuss the app? about.
Yes, I'd love to do that. And then just so if people want to see, you can view the whole toolkit at dandeliontoolkit.com. So feel free to have a look and see what this is. You can flip through all the pages in the notebook. So the other thing, so Know Your Lemons, we have like a couple different programs. So we have our campaign that I've talked about that's in 34 languages. And then we also have our volunteer educator program, which you're part of, which I mentioned. And then the third piece is this Know Your Lemons app. And what we want to be able to do is help people navigate their breast health in a way that's easy and has all the information right there for them, customized to their specific body. So the app has a couple cool features. The one that everyone loves is it sends you reminders every month to do a self-exam, right? And lots of people offer a self-exam reminder service. There's actually a lot of apps that have self-exam reminders. What makes ours really unique is that for people who menstruate, we time it according to your menstrual cycle, because you do not want to do a breast self-exam in the last half of your cycle, especially if you have fibrocystic breasts. And that's a really fancy term for they get really tender and they get really lumpy that last half of your menstrual cycle. And that tends to be when we do our self-exams.
Yeah.
Because our breasts are chatty. They're talking to us. They're saying, hey, like the you know, and then you're just like, oh, stop it, you know. And so we feel around and then we kind of notice some lumps. We notice things are feeling tender. And then a couple of weeks later, it just kind of goes away.
Right.
And then we're like, oh, so should I still be concerned? Right. And then things are right for a couple of weeks. And then you start to notice things ramp up again. And you're like, what is going on? So, I mean, we are very undereducated when it comes to menstrual cycles. Yeah, right.
We are.
Like the stuff I'm learning in my 40s, I'm just like, oh my goodness, right? I'm on my way out now. And now I'm just starting to get to grips with what, like, acknowledging the impact it has on my body, right? And so we have something called breast cycles. So every month we have hormones that come in at a different point in our cycle. And so if you have like a 28-day cycle, midway through, you know, like day 14, you're going to have estrogen, and that's like your fertility windows around that time.
Right.
And then after that, progesterone comes in, and that is when we see a lot of tenderness, when our breasts get more lumpy, they get swollen, like all of that stuff, right? And then when our period starts, and then we're bleeding, it's this drop in hormones that's happening, right? Because what's happening is our body's preparing for potential pregnancy. And then you're like, oh, not pregnant, bleed. Okay, so a few days after you're done bleeding is like the ideal window to do a self-exam, because your hormone levels are like lower. Right. And it's before this big estrogen boost comes in, it's before the progesterone shows up. And if you compare your breasts every cycle and in the same window, you're comparing like for like versus comparing at the end of your menstrual cycle and things all kicking off, right? To like a calmer time, it's going to be really confusing to figure out what's going on with your breasts. And what happens is, as women, we go, I don't know what's going on. And we either say, so I'm going to figure this out, or, oh, well, like, it's just one of those weird things that must just be me. Or, you know what, I'm really uncomfortable with self-exam. I keep finding lumps. It's making me nervous. I'm worried if I check again, I'm going to find something and it's going to be bad. So I'm just going to avoid it. And ignorance is bliss, right? And so for September, we're really going to be doing this big push when we're calling it Self-Exam September, which is, hey, take the pledge to start a breast health routine. Right. And all you have to do is download the Know Your Lemons app. It's free. It's going to set you up with reminders. It also has a risk assessment. So you can fill out these questions and it will tell you what screening plan you should be on according to your risk level. So it can say, hey, you should be starting mammograms every year, age 40, or actually, because of this and this, you need to talk to your doctor about starting mammograms earlier. Or talk to your doctor about doing a breast MRI because you have like a high risk, or you
Mhm.
should look into genetic testing because you've said yes to a couple of these questions, which is a possible flag. So here's how you talk to your doctor about genetic testing. So we have that risk assessment that tells you when you should be getting screened and when, and what tests to use. We have Mona Lisa that teaches you how to
Yes.
do a self-exam. And we also have Napoleon.
Yeah, that's right.
So for people who don't have breasts or used to have breasts, right,
Right.
they can self-exam with Napoleon, and he's pretty funny. And Mona Lisa goes into a lot of detail.
Mhm.
And she tells you what each part of the breast feels like and the 3 positions to use to do a really good self-exam. And we have had 5-star reviews saying, I love this app because I found a lump because of the
Mhm.
self-exam guide. Like, I did not know how to check my breasts before I had my session with Mona Lisa. And so, we were wanting people to be educated on how to do this, and then it'll send you a reminder to say, hey, it's that time of the month again,
Mhm.
time to do your self-exam. You do your self-exam, you go back to the app, you report it, and this fun little thing happens and a little celebration. And then you get added to our global total. So right now we've got over 10,000 self-exams that have been reported to the app.
Oh my God.
And so I'm like, someday we'll have 1 million self-exams
Yeah.
that have been
Yeah.
reported to the app. And we know that it's women saying, you know what, and men, I'm taking time for me to just do
Mhm.
a little check.
Yep.
And then I'm going on with my day, because a self-exam is not a hunt to find cancer.
Right.
It's to know your body. So that way, if something does change down the road, you go, hold on, you were not here before. And I know that because
Exactly.
I know the territory, I know the landscape of my breast. So so that's in the app. And then we also have a detailed symptom description for each symptom. So we'll say, hey, this is common for breastfeeding. This could also
Mm.
be this or that. But if you try this and this and it's not changing, then talk to your
Mhm.
doctor because it could be this kind of breast cancer. And then we have a doctor's guide of here's how you have the conversation. Here's the 4 things you need to say during your visit. Here's how to advocate for yourself.
Very
Here's the
important.
test you should expect. Because the most common story that we hear is that, like, let's see, I'll share Jessica's story. So
Mhm.
Jessica lives in France. She saw our 12 signs of breast cancer picture when someone shared it on social media a few years ago. And she says after she saw that, she decided, you know what, I should be better at my self-exams because I didn't know about these 12 symptoms, and I'm going
Mm.
to do better. So she was doing her self-exams for a few years, and then age 33 noticed a lump. And it's like, I know that wasn't here before. So she goes to her doctor who says, 33, like, you're too young. Um,
Yeah, the
yeah,
going, yeah,
go
freeze.
go home. So she went back home and was just like, she says, something didn't feel right. And that is the most common thread between all of these stories, are women saying, this just didn't feel right for me.
Mhm.
Like, trust that instinct, whether or not something turns out to be cancer. Trust that instinct, follow
Right.
it through. And if it turns out to be nothing, that's great, because now you have an answer and it's not on your mind anymore, right? But if it turns
Mhm.
out to be something, that's good too, because you've given yourself the best chances for putting yourself in the best position possible
Right.
for that by getting it found as early as possible, right? So it's
Absolutely.
always a good thing to, like, trust your instincts, listen to your gut and go, like, what, and have some
Mhm.
information to go with that instinct so you know what to do. So she went back to the doctor and said, no, like, something's not right. Dismissed twice.
Wow.
But because she knew the 12 signs of breast cancer, she started seeing other things kind of crop up.
Mm.
And she noticed that she had 3 symptoms. And this was the information that she needed to go, I'm pushing for this now. I'm not asking, I'm
Right.
telling. So they said, okay, well, we'll give you an ultrasound. Um, and then you'll see everything's fine and you can leave us alone. So she gets the ultrasound, and the technician's like, yeah, we can see something there, but like we don't think it's an issue. And she says, I just looked at them with this face, like, because again, she's like, I know I've got 3 symptoms
Exactly.
that like things are progressing in my breast. And so they said, do you want a biopsy? And she's like, yes. And she was diagnosed with stage 1 triple negative breast cancer, which is a really aggressive form
Yeah,
of breast
very
cancer.
aggressive. Yep.
And stage 1 is really hard to do triple negative with, but she listened to her instincts. She had the knowledge to go with it, and she advocated for herself, because in the end, no one cares as much about your health as you do. But
Absolutely.
sometimes as women, we're the last person whose health we look after, right? We'll be looking after the health of everyone around us, and we say, oh, I'll get to that mammogram next year. I'm busy. I'll get to that self-exam later, right? It's like, well, our health is important too. So it's good to prioritize that. So with the app, it keeps you on track, teaches you everything that you need to know. If you think you found something, the app will kind of talk you through it and be like, all right, well, what is it that you're noticing exactly? And it will help you take that next step. So, we've been able to save lives of women because they see our image, they take the next step to decide to do something more. We have this app designed to make that next step really easy. So the ideal is people see the image, they go, oh, I had no idea there were 12 signs of breast cancer. And we're like, awesome, let's teach you the rest. Download the
Right.
And then they use the app and they learn a bunch of stuff. And then they tell their friends and say, hey, have you seen this app? Right? Because as a charity, we don't have a big marketing budget. Like, you are our marketing budget.
Yes.
You telling your friends about the app, that's our marketing budget. Like, thank you very much. But nothing's more powerful than getting a recommendation from a friend to say, I tried this, I loved it, I'd love for you to do it too. So right now the app is in English and French. It's coming out in German next week.
Oh,
And then Spanish the month after that. And then Dutch is planned for the end of the year. So
amazing.
we're really excited for that. And it's fun because you can change the language on the app and then listen to Napoleon in French, teaching you how to self-exam.
I know. And I like that because a lot of people, they think, oh, you had a double mastectomy, so you don't have to check yourself anymore. But we still have to. I have a double mastectomy and flat. We still have to check because it could come back anywhere in the tissue in our chest wall. And some people it's the sternum. So we have to do these checks every single month as well. And even if you've had breast, and I think that's an important part too, if you've had breast, then you get a double mastectomy, you have to get reacquainted with your body. And now it's not, it's a whole different world. At one point I had a lot of fibrocystic tissue and things of that nature, so I couldn't differentiate lumps all the time. But when I found that one prominent lump, of course I could, but I knew my body. Sometimes it was kind of hard, but I knew my body for the most part. But then when I got a double mastectomy and became flat, now I'm fighting through scar tissue. What's scar tissue? What's a lump? So it's very important to still check every single month. And if you have ovaries and flat, you still could possibly, I don't know, I would think still have some issues as well. Maybe not as much because the breast tissue is gone, but still just check your chest regardless. If you're flat, whether you have breast implants, whatever, check your breast. And I think this is a perfect app. I use it. I downloaded it and I use it and it's phenomenal. And I just love the graphics and love hearing Napoleon and everybody else. So cute. So did you have, because I just want to ask you this one question because I'm not for sure. I've seen some videos of you at the doctor. Was that, I didn't get a chance to watch all of it, but was that something that you were going through or
so
just bringing awareness?
So I've not been diagnosed. What it was I have obviously an increased risk for breast cancer. I don't have a known genetic mutation. They're discovering new genetic mutations all the time. So that's why I use the phrase known, right? So far, I don't have what they know is on the list. And, also, being the CEO of a breast cancer charity, that is a work hazard because you hear stories every single day of unique ways people found their breast cancer. And so I'm hyper aware of this more than most people. So when it comes to breast health, I'm like very diligent and making sure I'm doing everything that I should be doing.
Right.
And so what I wanted to do is just make the process open for people to see what it's like to investigate a breast concern. So I had a lump that I had for a while. It had been looked at on ultrasound over a couple of years, never changed size. So like, we're pretty sure this is a fibroadenoma. The only way to check for sure is a biopsy.
Right.
And I'm very small chested.
Mhm.
And I was like, well, I think they'll just be taking half of my breast then, right? If they're going to do a biopsy on
Not a
this, you know, and so I'm like, okay, well, you know, putting all these things into consideration and listening to my gut, right? And my instincts were telling me, I think this is a fibroadenoma, right? It really isn't changing size. It's not getting worse, but it's painful. And sometimes it would like keep me up at night or wake me
Mhm.
up. And anyway, so I thought, okay, you know what? This is my annual appointment. I'm going to get some diagnostic tests done because this seems to be acting up and I want to pay attention to my body and make sure I am being diligent about
Mhm.
this. So what I did is I just recorded myself, you know, saying, hey, today I'm at the doctor and this is what I'm doing. And I'm looking at stuff because I know that there are women who are concerned about something.
Mhm.
And we have this fight or flight instinct, but we also have this freeze instinct.
Mhm.
And a lot of women freeze when they discover a breast change because they're
Right.
like, oh, I don't know what to do about this. And then they just kind
Mhm.
of put it off and put it off. And one of the reasons for that is that we don't have a lot of examples of like what this looks like. So I just wanted to open up my experience to people to be like, hey, I'm at the doctor and I'm going to ask for this and we're going to have this conversation. And then afterwards I say, okay, here's what the doctor said. And now I'm moving over to the next room and I'm going to be getting a mammogram. So then I got a mammogram and then met with the radiologist and he says, nothing showed up on the mammogram. And I said, I know, it never does. Because
Right.
where it's located, it's behind some dense breast tissue. And I said, I would just feel more comfortable with an ultrasound. He says, well,
Mhm.
I don't think you need it. And I said, I appreciate that, but I'm here today because I want this ultrasound. Right.
Right.
And then so we did the ultrasound, confirmed that it was exactly the same size it's always been, all of that stuff. And so again, this is just my individual story, right? Somebody
Right.
else is going to have a similar story and they'll be like, but it was cancer, right? Like,
Right.
so anyway, um, and I just recalled the feelings I had after that. So I'm in a pretty good position to be able to advocate for myself, right?
Mhm.
I know a lot of information. I'm very familiar with the healthcare system. I know how to navigate it. I know exactly what tests to ask for. I know the right
Right.
terms to use to like flag to the doctor. These are my specific concerns. And I still felt embarrassed.
Mm.
I still felt like, and I don't think anyone was necessarily putting me in that box, but I really felt like, oh, here comes the hypochondriac patient that's insisting on tests she doesn't need,
Mhm.
and you know, things like that. And but I'll tell you what, after I had that test, the pain went away. And I think
Mm.
there was something psychological that was happening with me that I hadn't experienced before. Again, this is just my story. This is
Right. Right.
like everybody's bodies are different, but I think there was like something that was kicking off, and then my worry and concern was adding another layer on top of that. And when they did the test, and they're like, look, I know this feels bigger to you, but it's not. I know this has gotten really painful. I mean, like pain was going up into my armpit.
Mhm.
And they're like, we can't really explain what this pain is. You know, and I was having like ice packs and all kinds of things on it.
Mhm.
And then when I had a test that said, this is fine, it was almost like my brain could like let go of that pain and
Mm.
go, all right, I'm not going to try and bug you about this anymore. Because
Wow.
I think my body was like, I just need you to check this. I need
Yeah.
you to check this, right? So that was really interesting. And just the benefit of having an answer
Mhm.
is really important. And I think a lot of times in the medical system will bring up a concern and it's like, oh, well, it's probably nothing. And then there's no answers, there's no
Right.
testing, there's no kind of and it's up to us to kind of trust our instincts and know what to push for and know what to ask for. But I'm incredibly privileged that I was able to have the funds to pay for those tests, because those
Right.
tests are expensive.
They
Um,
are.
and not everyone can, and it's silly that
Mhm.
that's the way the healthcare system's taken out. I mean,
Yeah.
that's 12 podcasts right there. But
Yeah, it really is. Cause I had to tell a friend one time, she had to lose everything in order just to get insurance,
Mhm.
everything she built. But it was either that or, don't fight for your life.
Right,
And
right.
it's sad. And I thank you for sharing and for even explaining what the videos were, because I think the fact that you have this great charity. However, I'm willing to expose myself. I'm willing to be vulnerable to the audience, which I'm trying to get to utilize these products that I have for their benefit, but it makes it more relatable. And I think sometimes it can be a detachment when we're not necessarily as transparent as we could be to share some of our stories and our scars. So
Yeah.
your scars of what you've gone through with your grandparents, your friend, your own personal, because all those feelings that you were saying you felt when you found that, that's what we feel. Like that's what the anxiety, is it cancer? And then the fact that you may have not have had it, but your grandmothers did, your friend did. And that produces some anxiety because and sometimes it's good to know things, but sometimes it's like, darn it, I know a little bit too much sometimes. It can
Yeah.
be scary.
Yeah, there's definitely a point where you've like crossed the line.
Maybe I
Of like,
shouldn't know
maybe
that.
less detail will be useful in this situation. And it's true, like as you're saying this, like when we walk into an appointment with a health issue that we know other people have had, it's not just us walking into that room, right?
Yeah.
Like I'm walking into that room with my grandmother's friend, right? And all the women that I've been blessed to know through the work that I do. Like those women are with me too, and I'm in that appointment and I'm thinking about them and what I can do. And so again, not everybody would go to the same lengths I did, but I am exposed to breast cancer stories every single day, right? And that weighs on me. And I also just want to make sure I'm setting a good example.
Yeah.
So so that was a real teaching moment for me, just going through that process of like, I know what to do, like this is fine, and then still feeling vulnerable, still feeling like I was a burden and that I was asking for too much. And just to see the change of after I had that clear answer, that my health improved.
Yeah. And sometimes, I had to tell one radiologist because my first set of biopsies came back benign. And she said, well, there's an area that we might need to reach, but we're just going to watch it. You don't want me to keep on cutting on you, do you? And I looked at her and I said, have you been through this? And that was all I said to her. And she was like, no. I said, so don't tell me what you think I want. And sometimes we have to be very blunt like that and it's not being rude. It's like, I am fighting to live.
Yes.
So I'm not going to allow you to dictate anything over here. I will bother you every day if I have to, because you're fighting. So I think that, once again, your video, that's powerful. I hope people will go back and watch it and that they'll go back and watch everything. I post a lot about Know Your Lemons on my social media. So I will repost the posters and different things like that since a follow-up from this
that'd be
podcast.
great.
But yes, I thank you so much for explaining your journey, because honestly, your scars from what you've gone through, your mental scars from watching people that you love go through has brought you to this place. And that's what I mean about our scars speak. And it doesn't just speak for those who are living, it speaks for those who've already transitioned or those who feel like they have no voice. So thank you so much for sharing everything that you've shared. And before we leave, there's two things. First, there's a song. So I chose it's Unstoppable which thank goodness you like it.
Yes, love it. Love it.
By Sia. So would you like to explain, because I know you say you did like that song. So would you like to explain kind of like why you like Unstoppable or the artist? Yeah.
I mean, first of all, I just love Sia. I think she's one of those kind of vulnerable people that also knows how to like draw boundaries around herself, right?
Mhm.
And she's like, hey, I know if my face becomes recognizable, this is going to cause my addictions to
Right.
be really vulnerable, right? And she's quite open with that. And so this song Unstoppable, really just speaks to, sometimes you feel like there's things in your way,
Mhm.
but just remember that part of you that pushes forward.
Absolutely. Absolutely. And the last thing that I would ask of you is, could you leave one word, and you can explain why you chose this word, for the audience, someone who may be out there that they have fresh wounds, or they have scars that are very difficult to look at on their body, or mental scars, something to help them get through.
I'll do 2 words.
Okay.
Push play. So this is something I discovered after going through a really dark time in my life.
Mhm.
Was, if we think of our minds like a tape recorder, maybe that dates me a little bit, but right there, we can choose where we are, like which button we push. We can go to rewind and we can relive bad moments again and again and again as much as we want. Like we can just sit on that rewind button all day if we want to, and like reflect on things and how we would have done it differently and stuff like that. And that's our human nature, right? Like we survive because we learn from things that impact us, right? And so we go back and we assess, right? After the assessment's done, then you need to move forward. But sometimes we can get stuck in that, like, assess, what was this, and kind of live in
Right.
those bad moments. Sometimes we can live in fast forward and we're like, oh, life will be so much better when this part is done,
Mhm.
or when this milestone is achieved, or when this thing is fixed, or right. And then we live in fast forward. And if we can take the time to push play, to recognize where we are right now and say, what is one good thing about right now, right? And and even like rewind can be positive things in the past. Oh, life was so much better when this and this was here, or this and this wasn't here, right? But if we push play, we can make now good. And that's the thing we have control over, is right now. Even if the best thing can be like, I just got some new polish on my nails and I like that, right?
Right.
Or these socks are really comfy, I enjoy these socks. Or I had a great conversation with so and so today and I just love that friend, right?
Mhm.
So find that positive thing, and it's that ability to push play that's going to change perspective, that's going to improve things, instead of living in rewind or fast forward, because that just robs you of now, because you aren't pushing play, you're somewhere else. So that would be the thing I've learned, is every once in a while I'll get caught up into something, and then I go, hold on, push play. What's something about right now
Wow.
in my life that I'm grateful for, that
I
I'm
love it.
enjoying, that's going well, right? Because there's always one thing
Yeah.
that can be nice, even if it's just seeing a pretty bird fly by, right?
Right.
It really changes things. So push play.
I love that. I love it. I love it. It reminds me of when I was going through cancer. Everybody's like, take one day at a time. I said, I'm taking 1 second at a
Yep.
time.
Yep.
I can't go any further. Before I leave
Yeah.
you with something, do you want to share where people can find you or find Know Your Lemons? Anything like coming up?
knowyourlemons.org. Yep, knowyourlemons.org is the website. Know Your Lemons on the app, at Know Your Lemons on Instagram, at Know Your Lemons on any channel. Like, we've done it. Like, we've got at Know Your Lemons everywhere. So do that. Something new that we're doing, if you work somewhere
Mhm.
we would love for you to introduce Know Your Lemons to work and educate all of the employees that you work with, your coworkers. So we've got a corporate education program that we're rolling out. And you can find out more information about that on our website. But let's get everyone educated. We want everyone to see this
Yeah.
image. So come share it on Instagram. And we want everyone to use this free app that's saving lives, because you never know who it's going to help. And it might be you.
Absolutely. Absolutely. Well, what I want to leave you with is the fact that when I read your story, your bio that you sent me, but then when I went online and looked through the whole entire website, and just hearing you today, you're a visionary. You're a visionary, and I don't ever want you to stop being a visionary, because visionaries are what we need in this world, because they can see ahead. They can see things before sometimes it happens, or they can see a need that we need before we even get to it. And even though what your vision was something that had been going on for years, as far as breast cancer, you had a vision of lemons. Some people may say that's kind of weird. No, it's not weird. That's what visionaries do. Like, they see things and they implement what they see. And because of that, now lives are being saved through a lemon. And then also other lives are feeling like they have control because of a dandelion. I can't even imagine what else you're going to use next, but
I'm running out of yellow objects, Christina.
not running out. You'll get something else. But you're a visionary, and please, for what I don't know whether you meditate, pray. I don't know what you do in your own personal time, but whatever you're doing to allow these visions to come to fruition, because I'm sure at some point there's times of being still, whether it's to journal, whether it's just to ponder, whether it's to dream, and those dreams come to fruition because you're a visionary. So never stop allowing yourself to utilize the gift which you've been given to have these visions to be able to help all of us. So I just wanted to leave you with that. You're very important. You're a very intricate part within this community. And just even as a person, you seem very nice and sweet and caring. And yeah, for you to even be touched by the scars that you had, you could have taken all that and just bottled it up, but you didn't. You shared, and we're forever grateful for that. So please continue to use your gift of being a visionary.
Oh, thank you. That's incredibly touching. I'm going to try not to cry. But that's so kind, and what a wonderful reminder for me to stop and think about for a while. I really, really appreciate that. It's really kind words.
Yeah. So, but that is the end for our Scars Speak for this episode. So thank you so much, Dr. Corrine, for coming on tonight. I appreciate it. Anything ever comes up that's new, let me know. I don't mind you ever coming up here, anyone in your organization, to come up here and speak and to get us abreast of anything that you have coming out that's new that you may want to share. So, but thank you again. Now, that's the end of our Scars Speak for this episode. It's been absolutely phenomenal. But remember that our scars do speak a story that needs to be told, a story about our mental and our physical scars, which can help other people heal. So until next time, we see you later, and we love you very much. Bye.